Reporting live from the Red Carpet Studios in Memphis. Thanks for watching Conversations with Betty LaMarr. Betty is renowned for her successful medical talk show. And now you're invited to watch this space for her new production, Conversations, which is laser focused on the health and social issues affecting Memphians and the Mid-South community. And now, your host, Betty LaMarr.
Hello and welcome to this special edition on cable tonight. This is Medical Talk, where we keep it plain and simple. Today, our topic of discussion is breast cancer. I know I've heard you all have asked me, Betty, why haven't you covered breast cancer? There are so many women that are being affected by it. And as we will find out a little later in the show, men as well. Yes, men also can be, I guess you would say, have breast cancer. I have a very special guest with me today. I'm thrilled, actually, to have yet another one of the masters from the West Cancer Clinic with me today. And he is Dr. Michael Berry. Good evening, Dr. Berry.
Good evening. Thank you so much for having me.
Well, I'm so happy to have you here because, as I said, there's that has asked me, Dr. Berry, why haven't we talked about breast cancer? But of course, I do this on a monthly basis, and there's so many health issues and concerns that, you know, you have to get to it when you get to it. But I'm so happy to have you because you come highly recommended.
Oh boy.
Yes, you do. And as always, I'll ask my guests to just tell our viewing audience a little bit about you,
Sure.
your credentials as they relate to our topic of discussion this evening, which is, of course, breast cancer and surgical oncology.
Sounds great. I was actually born in Memphis, and we moved away, and I grew up in Arkansas, and went to medical school and did my training mostly in Texas, and did a breast surgical oncology fellowship at the University of Texas Southwestern in Dallas. And in 2002, I believe, moved back to Memphis and started a practice there. And it grew to the point that several years ago, West Clinic wanted to add breast cancer as part of their kind of service line, so to speak, and incorporated us. And now it's actually even moving forward. We're merging a little bit with Methodist Health Systems and the University of Tennessee. So it's become quite an endeavor now. I'm the director of the West Clinic Comprehensive Breast Center, and we're excited about some of the neat things that are happening, some of the research that's out there that's available. So I really appreciate the opportunity to speak with you tonight about it.
Well, I really appreciate having one of the masters with me on stage this evening because, you know, that makes my job a lot easier, okay? So anyway, let's go into a few questions here. Do we know what causes breast cancer? Because, you know, I think about this, Dr. Berry, you know, is it something that we eat? Is it something that we drink? When I see women, for instance, that put their cell phones in their bras, for some reason that bother me because we don't cause breast cancer. So is that a question that you guys know yet?
No.
Okay.
We get that question a lot, though, and I think people really want an answer, and it bothers people
Yes.
when you don't have an answer to something. And so much of cancer research, breast cancer, all different types of cancer, we believe that there's both two components: a genetic component that predisposes someone to developing a cancer, and then an environmental component, something that has hit one of their genes and allowed it to develop into cancers. But we also know that cells will develop into cancers in a normal process. We have a whole line of an immune system that has cancer killer cells or tumor killer cells that will scourge, go through the body and look to see if there's any evidence of cancer and kill those. So why do some make it past that line of defense? We don't know. Now in breast cancer, we know that there are some genetic mutations that are responsible for about 7 to 10% of breast cancers. And in those genetic mutations, the body's ability to correct DNA breaks and DNA problems, you don't have the repair protein. So we say, okay, well, everybody's going to get these breaks, but if you don't have the repair protein, you may be more apt to develop a cancer. I make the analogy, it's like having an airline without mechanics. You can fly for a while, but eventually if the engine drops off, you're going to crash. And so that's a situation where we can say, you know what, I know why those folks have breast cancer.
Okay.
It's the other 90% that we just don't know.
God, and that's, you're right, because that's the scary part, because when you don't know what caused breast cancer, I'd like to say with the cell phone, I go back to when I see women put the cell phone down in their bras, I'm like, how does it cause breast cancer? I have a habit of not standing in front of my microwave because I don't know. It's like you said, just the not knowing.
Right.
So I try to avoid things that, just in case 20 years from now we find out, when you girls were standing in front of the microwave, waiting on dinner. So, and let me jump here too, before we go to the next question, who's at risk of developing breast cancer. I want to just go through a few of the breast cancer facts.
Okay.
And if you want to jump in on any of these, please feel free to do so. So now we're talking 1 in 8 women will be diagnosed with breast cancer in their lifetime. That's 1 in 8. Breast cancer is the most commonly diagnosed cancer in women.
Correct.
Go back to again, why?
Well, obviously, we don't know exactly why that is necessarily the case. Obviously, women have more breast tissue than men. You spoke earlier that men can develop breast cancer, and that's true. We believe that some of it is the hormonal fluctuations that we're seeing with pregnancy and with just the monthly cycle, that there may be some issues with that. So the longer your hormonal exposure is to the breast, there is something triggered at some times. If anyone could really figure out what that trigger is, that's Nobel Prize time, and they really make a real change for us.
Oh my God, it would just be so wonderful. And I believe, because I'm I guess an optimist by nature, but I just believe that eventually, because we have come a long way.
Sure.
We've come a long, long way. Okay, and we're going to talk about too, since we mentioned the men. Okay, although breast cancer in men is rare, an estimated 2,150 men will be diagnosed with breast cancer, and approximately 410 will die. So what causes some men to get breast cancer?
Men will have very similar, just not as much of it, very similar tissue to women in the breast. The ducts that transport milk to the nipple in women, men have the ducts. They don't have the lobules where the milk is made, but they do have the ducts. And that's, if it's there, it's also susceptible. We don't know how the hormones play in that. Fortunately, it's a low number, and actually, surprisingly, it's treated identically as to women's breast cancer. You usually find breast cancer a little bit later in men because they're not undergoing screening mammograms where you'll catch something a lot smaller. Men, you're usually waiting till you find it by feeling it. Ooh. And then you've got to get past the point of, well, heck, I'm a man, I can't have breast cancer.
Exactly.
So we usually catch it a little bit later, but it's usually treated identically and with similar outcomes, men versus women.
Hello, thanks for watching Medical Talk with Betty LaMarr. Today is the start of a series of shows focused on breast cancer awareness. Betty has 2 sisters diagnosed with breast cancer. Betty's sister Margaret Spann passed away at age 51 fighting this disease that affects women and men. Stay tuned for insightful conversations in Betty's upcoming series to learn what you need to know about breast cancer, including top doctors and inspirational survivors who are living well with breast cancer.
So who's at risk of developing breast cancer?
Well, number one, like you said, are women.
Okay.
The highest risk of developing are actually Caucasian women of Scandinavian descent. That seems to be a higher risk group. African American women tend to have a lower risk of developing breast cancer, but for some reason, the cancers that they do develop seem to be more aggressive. And even when you take out, well, they didn't get treatment or they didn't have access to early detection, even when you correct for all that, there's something about that cancer often, not always, but often in African American women that is more aggressive. So race plays a part of it, hormone exposure plays a part of it, obviously genetics plays a part of it. We talk about genetic mutations, and those are the genetic mutations that we can test for. We may find 20 years from now that the list that we can test for now that contribute to breast cancer, which may be 10 or so, maybe 50 or so in the future. So every little bit adds to the component of building the whole picture as to who's going to develop this.
Okay, so what are some signs and symptoms that we should watch out for, anyone with breast?
The racial disparity in deaths from breast cancer has remained at 40% or higher for a decade. Black women younger than age 50 had a death rate that was twice as high as white women that age. Plus, black women are more likely than white women to die of breast cancer at any age. AON women were 17% less likely to be diagnosed with breast cancer than white women, but 4% more likely to die from the disease. Part of the reason the breast cancer death rate is not dropping as fast as it has in previous years is because screening rates aren't increasing and too few women are receiving timely and high-quality treatment after they're diagnosed with breast cancer. The study authors point out that progress against breast cancer mortality could be accelerated by mitigating racial disparities through increased access to high-quality screening and treatment via nationwide Medicaid expansion and partnerships between community stakeholders, advocacy organizations, and health systems.
Sure, anyone with breast, obviously women are the biggest risk. Things like a lump that you feel. Now, that's a very interesting question because women feel lumps all the time. Mm-hmm. And they'll come and they'll say, well, how do I know that this is something? And answer is, well, sometimes I don't know that what you're feeling or what I'm feeling on your breast is of any concern. One of the things I talk about sometimes just that you can do, if it feels like the palm of your hand, that's fairly normal feel to the breast. There's sort of ridges and lumps and bumps there. If it starts feeling like your knuckle, kind of hard, kind of pushes back, that's something that you need to pay attention to. The phrase I'll often use is dominant mass. It just feels in any other area within the breast. If you have dimpling or puckering of your skin, if your nipple starts to invert, if you start feeling masses under your armpit or red, swollen breast, these are things that you need to pay attention to. What my real desire would be is that everyone's getting mammograms and that you would detect something before you have some of these signs. But sometimes these signs happen even with normal mammograms. So it's important to be on the lookout for these things that we just mentioned and to continue to get your mammograms.
Okay, well, speaking of mammograms, actually mine, I have mine set scheduled rather for tomorrow.
Oh, great.
Yeah, I called the VA and it just dawned on me, it's time for me to get my mammogram. I'm doing this show about breast cancer and I'm a month late on my mammogram. So they, of course, because of my history, and we'll go through that in a little while, they got me in, like right away because we don't play with that.
Tune in on Fridays at 9:30 p.m. on Xfinity Cable Channel 17 for Medical Talk with Betty LaMarr and Laura Scott. Medical Talk is exciting and informative, featuring top doctors, medical professionals, and inspirational patient testimonials. Now, back to Medical Talk already in progress.
They want the patient to be taken care of safely and effectively as well, and you just take an empathetic approach to it and have a rational conversation with them and
Okay.
They can be rational.
Yeah. Okay, so one of the newest advances in breast cancer screening is 3D mammography. What is that? How does that work?
3D mammography, another name for it you may read about is called tomosynthesis.
Okay.
Now the standard mammogram will compress the breast this way,
yes,
and then compress the breast from the side. It's taking two views, so it's a two-dimensional view, to recreate a three-dimensional structure. And there are many times that women will go get a mammogram and there'll be an abnormality and they'll say, hey, we want you to come back and let's do additional pictures. Let's compress the breast this way or fold the breast this way. Let's get some additional pictures because this area that's concerning may go away when we look at it differently. Ooh. What tomosynthesis does, instead of just taking those two views, it takes several views as the radiation head moves. So instead of having a mammogram of 2 views of each breast, it will be a mammogram of about 10 views of each breast. Now the beauty there is that additional picture that the radiologist might otherwise want now they may have.
Okay.
And so now you don't have to come back because they can look at the next picture and go, oh, okay, I was worried about this initially, but I'm not seeing that as a problem. Now, everything has its pros and cons. The downside of that is you're getting more radiation.
Oh.
Whereas a typical picture of a mammogram, the amount of radiation you're getting is about the amount of radiation you'd get from a plane ride from here to Dallas.
Okay.
So if you're adding 10 of those to each side, the amount of radiation is going up.
Okay, so I just have to jump back to this again. Radiation. Cell phones, do they not have some radiation, and do you think that's smart for women to use their bras as a cell phone holder?
And honestly, we don't know. And we just don't know. We know that some radiation can cause cancer. As a matter of fact, the question arises, do mammograms cause breast cancer? And the statisticians have looked at that, and they feel like, you know what, probably in about, and why it's one in a, we say 1 in a million kind of as a cliche, but they figure that it's about 1 in a million patients may actually develop the cancer from the mammogram. Now, we weigh that against the benefits of early detection, and we say, okay. Even though we may be hurting 1 in a million, we're helping many, many more.
That's right.
So there may be some things, and there are things that, you know, every day, for a while, remember there were, that the breast implants were the big scare, but there's been no data that suggests that that's a problem. So what seems like conventional wisdom at first, when it's really studied, may not be the case at all.
Okay. Now let's talk about some myths, if you will, surrounding breast cancer.
Okay.
And one particular I want to know about. Finding a lump in your breast means you have breast cancer.
So heavens no. As a
Okay.
matter of fact, the vast majority of lumps that you're going to feel are not breast cancer. As a matter of fact, the vast majority of things that we even go, I'm worried about that, I'm going to biopsy it, turn out not to be breast cancer.
Okay.
So just because you feel a lump in your breast, it may scare you, and it may scare you into action, and okay, that may be good if it gets you to act.
That's right.
But the majority of things that I see during the day, and I have a cancer clinic, is not cancer.
Okay. Thank God. Okay, now, you spoke a little bit about this a minute ago, but we'll just extend it out. A mammogram can cause breast cancer to spread. Say like if you already have it and you go get a mammogram.
Right. There's no evidence of that. What really
Okay.
tends to make breast cancer spread is the fact for a cancer to be alive, since it's existing outside of the regular structure of the breast, it has to create its own blood supply. And so once its own blood supply comes in, now it can shed cells into that. And it can do that early before we could ever detect it. So the mammograms causing cancer, we talked about, and that is extraordinarily rare, and I would never want anyone not to get a mammogram because they were afraid of it. But I certainly would not want someone not to get a mammogram if they thought that it may cause things to spread. People also ask me about that surgery. Hey, if you biopsy this, or if you operate on me or expose it to air, is that going to create the spread? And that's not the mechanism of spread of really any cancers, but especially not breast cancer.
Okay, well, what about antiperspirants and deodorants?
They actually looked at that.
Yeah, because I really want to know about that too, because I remember once I started using this Tussie, I think the name of Tussie. It's this old school antiperspirant that women used to use because they didn't have some chemical in it that we have now. So is that a myth?
It is a myth. They've actually looked at it, and the thing that people seem to be the most concerned about is the aluminum, but there really doesn't seem to be any connection with that right now. They say, well, most of the cancers happen in the upper outer part towards the armpit, but that's where most of the breast tissue is.
Okay.
But they've actually looked at it, and they took women that were using antiperspirant and women that weren't, and I guess I wouldn't want to be around the group that wasn't, but they looked, and there was no difference in whether there was antiperspirant or deodorant. They broke them down into two as to whether there was increased incidence of breast cancer, and that study showed that there was not.
Okay, now this is going to be the last myth, and then we want to talk a little bit about Angelina Jolie, because I need to talk about my sisters. Okay, if the gene mutation, I guess BRCA1 or BRCA2 is detected in your DNA, you would definitely develop breast cancer.
Not true. As a matter of fact, a lady in the office today that was 71, has a BRCA2 genetic mutation, has never developed breast cancer.
What is that?
BRCA1 was the first that was determined, and it is, again, the inability for you to create a repair protein for your DNA. So it makes you susceptible to developing two major cancers in women: breast cancer and ovarian cancer.
Okay.
If you have that genetic mutation, your risk of developing breast cancer, and the numbers vary, anywhere from 50 to 80%. So flip that around, there'll be 50% or 20 to 50% that never develop breast cancer in spite of the fact that they may have that mutation. The other risk that you have is ovarian cancer, up to a 40% risk of ovarian cancer. So it's important for us that even if you haven't developed that cancer, to monitor you closely, because we know that you're at very high risk. Also to be aware of your siblings and your children. You may get through life without developing these cancers. Does not mean that your offspring will do the same.
Regular breast cancer screenings are crucial. You should make an effort to start mammograms at age 40 and continue annually. Early detection is key for successful treatment. Discuss your risk factors with a healthcare professional. Genetic testing can reveal inherited risk factors. Black women have a higher risk of aggressive breast cancers and are 41% more likely to die from breast cancer than white women. Addressing systemic racism and improving access to quality care is essential. Remember to consult your healthcare provider for personalized guidance. It is crucial that women prioritize their overall health and wellness. Now back to Betty.
Okay. Now, we're going to talk about Angelina Jolie.
Okay.
And in just a moment, I'm going to ask Chip to put a picture of my sister up. I'm going to give you a little bit of my history.
Sure.
When my mother was pregnant with me 59 years ago, she had a cyst in her breast.
Mm-hmm.
And I remember her telling me when I was about 1 month old, she had to go to the hospital back then down in Mississippi, and they took the cyst out. When I was about, I guess, 14 years old, I was one of those people that found I had this little ouch feeling, and found a lump in my breast. And I was debating as a young girl to tell mom, because I knew she would have to look. You know how we are.
Sure.
I was just developing. But something inside me said, yeah, your mom needs to know about this, because this feels like a marble. That shouldn't be there. Like you say, you'll know because it just doesn't feel right.
Right.
So my mother took me right away. That was back before I even knew if cancer existed. I didn't know, I was a kid, but my mother immediately took me to the doctor. And they found that I had 5 in both breasts. My sister was diagnosed with breast cancer in her 40s. Mm-hmm. She passed away at 51. And she also had a lump way earlier than she ever even thought about breast cancer. And then, like I said, later on she ended up with breast cancer and passed away. And since then, another sister, she's between her ages, between the two of us, she was diagnosed with breast cancer. It was small, and she took some kind of radiation kind of pills or something. I guess it's something they do now. But my first sister that had breast cancer, she had the aggressive type breast cancer that ultimately went to her bone and to her brain.
Right.
And so we're talking about Angelina Jolie. She had to have a double mastectomy. Would something like that possibly have helped my sister? And what should be my concern and my other sister, because my mother had 4 girls, what should be our concerns because of my two eldest sisters having breast cancer?
Okay. Let's go to Angelina Jolie.
Okay.
Why did she know that she had a genetic mutation? Well, her mother developed ovarian cancer, and she developed it at a young age. And that's one of the things that we're seeing with women that have these genetic mutations. They're developing either breast or ovarian cancer at an early age. Typically, the breast cancer you'll see in the 30s and 40s. Mm-hmm. The average age for breast cancer is about 55. So when you start seeing premenopausal women with breast cancer, that's something that ought to pique your attention.
Okay.
Same thing with the ovarian cancer. So her mom had young ovarian cancer, was tested, found to have a genetic mutation. Now, that is a mutation that can pass down to the children. A boy can inherit it. You can inherit this from your father. She happened to inherit it from her mother. And each time that you have a child, the way the genetics work is it's 50-50. So if you had 4 children and you had a genetic mutation, statistically, half of them would get it, boy or girl, and the other half wouldn't, boy or girl.
Okay.
She was tested, found out that she had a genetic mutation, and then it went back to the numbers we spoke about earlier. She then made the decision, I don't want to sit around and wait for a up to 80% chance of developing breast cancer.
Okay.
I want to make that number as low as I can and remove both breasts. And now her risk of developing breast cancer is about 2%. It's not 0, but it's about 2%. So then we say, okay, well, that's Angelina Jolie. How does that relate to you, or how does that relate to me? And so one of the things that when I'm talking to women that are premenopausal, I will talk to them about, let's sit down and talk to our genetic counselors. Sometimes you can draw a family tree and it's fairly evident that there's not a genetic mutation at play because, again, statistically, half of the people are going to get something. So if you've got a family full of women on either side of the family and nobody seems to have ovarian cancer, it's unlikely that that's the case. But I will go through this checklist in my head on when do I start worrying about a genetic mutation. Women that are premenopausal with breast cancer, women that have cancer in both breasts. If you're young with ovarian cancer, or if you have breast and ovarian cancer, or if you're a man and have breast cancer, if you're Ashkenazi Jewish with breast cancer, if you have a triple negative breast cancer, we can talk about that, less than age 60, those are some issues that I'll begin to look at. Or if you have 2 or more family members less than age 50 with breast cancer, now then I start to say, maybe we ought to investigate this further. Now, who do we go test? Well, we try to test the person with the cancer, because if you test and you're negative, well, that's great for you, and we get that information for you. It really doesn't tell you much about your family.
Right.
So your sister could be positive, you could be negative. And so what would we want to do? We would want to test your sister in that particular instance.
Okay.
If she's positive, then you too could be positive. You have a 50-50 chance of being positive. Then we would test you.
Okay.
And sometimes that's difficult though. Family members pass away, family members are not interested, and sometimes we have to test the person that doesn't have cancer. But your sister would be where I would go first.
Okay, well, my sister, the one that I mentioned that was diagnosed since, did have the, what do you call it? The
BRCA1 or 2 genetic mutation?
yeah, she was negative.
Okay, good.
So is that good? Is that a good sign for me?
That's good for you. Now, there are others, very few others, that may relate to it.
Okay.
But for all intents and purposes, that represents about 90+% of the genetic mutations that are going to cause breast cancer.
Okay. Well, you know, oh my God, it seemed like Dr. Berry, this 30 minutes has just flown by. So you know what that means. There will be a part 2.
Bring me back.
Because,
I'd love to.
yes, because, I mean, we can talk about this all day and still not get, because you've given us so much good information. So much good information. Now I see why everybody's asking me, why haven't you talked about breast cancer? Because there are a lot of questions out there. But, you know, in closing though, and even though we didn't get to, I do want to ask this really quick question, and then I want you to, in closing, just tell everybody where they can find you, if they want to see you, if they have any concerns. What treatment options are available?
Endless. You know, it used to be the old days that you'd have to have what's called a modified radical mastectomy. You'd lose your breast, we'd remove all of the lymph nodes, and we've really gotten away from that. We know survival is the same whether you do a lumpectomy or a mastectomy, so now you're able to keep your breast. As a matter of fact, we're even doing trials now where we don't even remove tumors. We're freezing them in the breast and never going to surgery.
Wow.
So we're at the West Clinic Comprehensive Breast Center. You can find us online. You can look us up in the phone book. We're building, I think, a really neat program, and I'm really excited for what the future holds.
Tune in on Fridays at 9:30 p.m. on Xfinity Cable Channel 17 for Medical Talk with Betty LaMarr and Laura Scott. Medical Talk is exciting and informative, featuring top doctors, medical professionals, and inspirational patient testimonials.